Welcome to the Miracle Mama Show. My name is Ashley Sabali. I'm the founder of Miracle Mamas, which raises the bar of maternal health one step at a time. And I'm so happy to be back on this podcast. It feels like I haven't been here in so long. Yes, I've been blonder, and I am really excited to have a guest that has actually, she was one of my first guests on the Miracle Mama Show, Johanna Kasperski, who's also a really good friend of mine. Joanna, would you like to reintroduce yourself to our listeners and viewers?
Hi, everyone. I am Johanna. I am the current Mrs. Illinois American, and I am a mental health therapist and a proud mom of a 2-year-old named Deborah.
Thank you. And I know today we're going to be doing a little bit of a different topic called IVF and in vitro fertilization treatments. And I'd like to ask about, you know, basically your experience with this, as you've had a lot of experience in IVF. So maybe we can start with what is IVF?
Yeah, so IVF stands for, fertilization that just essentially occurs outside the body. So putting together the sperm and the embryo in a lab setting. It's often done when people struggle with issues with infertility, or let's say there is some concerns for genetic disorders. They are able to do screenings before the embryo is implanted.
So what has your experience been in IVF? And why
So
did you choose to go that route?
yeah. I just went through my first round of IVF. I decided to go that route because when I was pregnant with my daughter, because I was considered a geriatric pregnancy, my OBGYN suggested that I do genetic testing. And I found out that I was a carrier for cystic fibrosis, which I had no clue. So they suggested at that point my husband get tested because if both parents have it, it's a 25% chance that your child can have it. Andy has it too, so we are both completely shocked. Luckily, Dee Dee does not have it. And so it was after that we were talking to our physician, and she really suggested IVF for the next child because of the high risk. So we decided to start that process in the spring.
And can you tell me about that process? How long does it take? What are the different steps that you have to take with your clinic?
Yeah, it's a really intense process. It's really scheduled, right? So not to be TMI, but you have to once your period starts, you call them 2 days after that, and they get you into the clinic for all your testing and your baseline scans and blood tests. And then you start on your medications, and that might be different for everyone. It's really catered to the person. Some people have to be on like a human growth hormone. There's different types of fertility medications. I was on 3 different shots and a pill as well. We started with like a lower dose to start because it wasn't fertility issues that we are coming to the clinic with. And, after you finish your treatment, which is usually about a month, you go for your egg retrieval. And that's when they retrieve your eggs and you find out how many eggs you got and if they're viable. And then they take time for it to grow to see if it goes to the next stage where they could implant it.
Wow. And for the shots, going back to those, are those self-administered? Did your husband have to help you with those, or did you have to go into the clinic to get those done?
My husband had to help me, and they send you like YouTube videos to teach you how to do it. And he was so freaked out at first, but
Oh
he was a champ.
God.
He did really well. The only time I had to give it to myself was when he went out of town, and I was like so bad at it. I gave myself a huge bruise on my stomach. But yeah, you have to do them yourself. So our like guest bathroom looked like a little pharmacy. We had like the sharps containers and everything set up.
I mean, I'm laughing, but I mean, I'm thinking about my own husband. So your husband's
Yeah.
a trooper. My husband, bless him, I don't know if he could do it, do the actual shots, but
Yeah.
that's a lot that you had to go through.
Yeah. No, it's funny because it's funny because you could laugh about it now. During the time, it's like it's so stressful because
Yeah.
I asked my mom, I'm like, can you do the shots for me while Annie's out of town? She got so nauseous, she freaked out. She started crying. She's like, I can't do this.
Oh no.
And I'm like, okay. I'm like, I'm just gonna do it. And I just jabbed myself in the stomach. And she's like, oh my God. And then I got this huge bruise.
Yeah, I can see him hitting the floor.
Yep.
Which
That's
he
my
probably
mom.
wouldn't appreciate if I'm saying this live on YouTube, but it's but yeah, I mean it takes a good stomach to do something like that just to somebody else.
Right.
So that's a lot. So through this process and even through the egg retrieval, what was how was there any kind of physical or emotional toll that it took on you?
It really took an emotional toll on me. I mean, your hormones are all over the place. It reminded me of like being pregnant again, right? Like wanting to like cry for no reason and things like that. What I didn't expect was like after it failed. So it didn't work for me. It failed. I got that email from the lab saying that like the eggs didn't progress. I got they retrieved 7 and they were able to use 4, and all 4 of them did. The word like coming to my mind is like passed away, but I know that's not true, right? It failed. But it was so weird because even as a therapist, I wasn't prepared for the mental health toll it took on me, because it felt like you're having like 4 miscarriages outside of your body, and it was really traumatic. And it took me some time to recover from it. And what really surprised me, that there's no mental health resources. We go to a very nice fertility clinic. It was never discussed. There was never any brochures or resources. And you just get this very cold email from the clinic saying it didn't work. Try again.
Yeah, I'm surprised it was an email and not someone over the phone or an in-person appointment, but I mean, that's an interesting part that you brought up, and you are a licensed therapist, and you have your own therapy practice yourself, right?
Yes.
Do you want to talk a little bit about that? Because I'm
Yeah.
always excited
Yes.
about your practice. It's so
Yeah.
amazing.
Oh, thank you. It's called White Orchid Counseling. We're a group practice. I have 5 amazing therapists that work for me. We specialize well, so many different things. I specialize in trauma, and now in fertility and IVF. But we have child therapists, adolescent therapists, family couples therapists. We have the gamut. So anything that you need, you can get through White Orchid. And that's, why I really wanted to start promoting mental health treatment for IVF, because it's just not there. So my goal is to really make White Orchid a hub for that, and to connect with centers in the area. So, these mothers have a place to go, whether, you're, struggling to get pregnant the second time, because I have friends going through IVF and they have 1 kid, but the second one's, it's hard for whatever reason. And just
Yeah, I
having to
mean,
say that it's
I could
normalized. Yeah.
I couldn't really imagine that. I mean, the only thing I could, it's not even a comparison, but I lost my first very early on, and when I first got married, I had a miscarriage, and that was not, you're just not prepared. And when you're going to the OBGYN, you're getting your ultrasounds and everything, and you're going through the process, you're not really mentally prepared that it may not happen, and maybe there's a reason, maybe they don't want to put pamphlets or brochures of what, may not happen, but I think it's nice to have some kind of support, because otherwise
Yeah.
you feel alone. I can only imagine, even with IVF, I mean, it's very, very similar that you feel alone. Would you give to moms or women who, are wanting to be a mom and are going to be exploring IVF treatments?
Yeah. I would definitely seek support right away, whether that's with a therapist or a support group, just so you have that mental health support throughout the whole process, right? Because, it's not just if it fails, right? Like you might have your first round of IVF be completely successful, but there's a lot of stress even before that, right? There is the change in your hormones and having to give yourself these shots. The egg retrieval can be scary. So if I had to do it over again, I would have joined a support group, I think, or got a therapist that specialized in it, just so I was prepared and I had someone to go to who understood, right? Because, as supportive as my husband is, he's never going to fully understand it. And I think he was upset too, because there's nothing he can do. and he sees me upset and crying and just feels like at a loss. So I even felt bad repeating myself over and over again to him, but having a professional I could go to just express those emotions would have made a huge difference.
No, I think that's excellent advice. And I mean, and even when I mean, if they are successful and, you're pregnant, I mean, just going through the pregnancy, I've known women who absolutely love being pregnant and they're glowing and there's no issues and everything's great. And then there's a lot of women who, I mean, they go through their ups and downs. Your hormones are everywhere. Your body is changing in so many ways, many of which that
Mhm.
you didn't know that could happen. Especially it's
Yes.
the first time I'm looking, I'm like, what is going on with me?
Right.
And
What is this? What is this like lying down my stomach? What is happening?
yeah, like what's going on with my breast? And I'm just, you're kind of like, wow. And then do I feel attractive? I don't really feel attractive anymore. I mean, there's a lot of mental things that go on. So I think you really hit the nail on the head that having that support group and having that structure, even beyond like your significant other, whether it's, your boyfriend, your partner, your husband, whatever your situation is, having that structure, I think is really important
Yeah.
because for your not only for your physical well-being but your your mental health.
Yeah, yeah, I agree because like you said, like, if it works out, pregnancy is hard, right? Like I was not one of those women that was glowing and loved it, right? Like it took a mental toll on me. It really did. And I wish I had the support from the onset. So I was able to navigate it better. But, but there's no shame in it too if it's something you don't think of, right? I talk to other women because I had postpartum depression. Like, why didn't I get help sooner? Why didn't I get help during it? And you just don't really think to sometimes because you're so overwhelmed. You're just trying to get through each day. And I always say as a therapist, I didn't think to do it, right? I just wanted to get through this pregnancy and each day.
Yeah, and you don't, I mean, even when I'm thinking about myself and other women I've spoken to, you don't really know what's normal and what's not because you're just kind of you're going through it, like you
Yeah.
said, day by day. But I wanted to ask, and I think we might have touched on this a little bit, but what are your advice as far as coping mechanisms for women in which, like, let's say the IVF treatments unfortunately do not work on a particular round? Where are some coping mechanisms that you could recommend?
Yeah, so if it doesn't work right, it is traumatic, right? We can define it as trauma. So I suggest finding, a therapist who's trauma informed, but who also understands IVF, but does certain coping skills that are really effective for trauma.
Okay.
So EMDR, or psychological tapping, or somatic therapy, because that is really body based, right? So I actually love somatic therapy for IVF because we hold our trauma in our body. And somatic therapy, it not only like helps you clear the trauma mentally, but also physically.
Okay.
Yeah.
No, thank you so much, and thank you for talking more about this. I'm wishing you the best of luck for the future. I mean, are you planning on doing future rounds, or are you kind of holding off for now?
We're going to do another round
Okay.
probably in the fall after I'm done competing. And it gives my body a break, so it kind of worked out perfectly because my doctor didn't want me to jump right back into it. He put me on like 100 vitamins to improve egg quality. So I have to hope, fingers crossed that works. And they're going to put me on human growth hormone this time too.
Okay.
So he wants me to, rest, give my body a break, and probably start in September.
Well, I'm wishing you all the best, sending lots of prayers your way. And you mentioned competing, and you have this beautiful sash on you. Would you like to mention about what you're competing for? I mean, I know, but but I want you to share it because it's super exciting.
Yes, I am competing for Mrs. American, and I will be competing in Las Vegas. The competition goes from the 19th to the 28th. So I'm so excited.
I'm so excited for you. I mean, you're going to have an amazing time. It's a very prestigious pageant system. I've had the opportunity to go there at nationals to support friends. So I was in the audience watching, and it is an amazing, amazing experience. So I'm wishing you all the best. Um, at your competition as well as for your family and whatever your journey brings you to. So thank you so much again for jumping on the Miracle Mama show, and I hope to have you on here again sometime soon.
Yes, thank you so much for having me again. And then anytime you need me, I love coming on and chatting with you.